Before I begin my talk, how many of you are actually early practitioners? Okay, so some of them. Right. Okay, good. So whatever you are doing, ultimately you have to earn some money, right? Nobody is going to give you anything for free, right? So when I set up my clinic, I went to the real estate dealer. He said, "Sir, you'll get it for you 150 rupees per square feet." So like 150 per square feet. So it's like rental would be for 1,000 square feet would be 1.5 lakhs. So who's going to give that? Sir, आप ही देंगे. फिर थोड़े दिनों बाद, then after some time he says, comes and with his wife and, sir please देख लीजिए, हमारे बच्चे को देख लीजिए, हमारी wife को देख लीजिए. And then I charged him, and he was offended. So this is how the doctors have to work. Ultimately, you have to earn some money. You have to earn it smartly. You don't have to earn it unethically. In this talk, I'm going to give you small insights that I have done with my practice so that you can earn money ethically and still be profitable. So what is ethics? So ethics are basically the moral principles of practice. They are the principles that guide you. Okay, they can be good or bad, but when we talk about ethics, they should be good. Now, how can something ethical be profitable? So this is like good or evil. These are like two opposite sides of a coin. But I'll tell you, what is right, what is wrong. It is not unethical to make profits, but it does matter about the way the profits are earned. Please remember that. Any benefit by short selling, by doing negative counseling, by demeaning others, or by saying some untrue things would give you good profit in the short run, but it is not sustainable. Management studies have proven that ethical practices, whether it's medical or non-medical, go a long way rather than the short selling. So what is specific for ophthalmology? So this is from the AIO guidelines for ethics. So what is our ethical conduct when we deal with the patient? Not even think of doing something with the patient in which you are not comfortable or you haven't been trained of. Always communicate with the patient openly. Tell him each and everything. How you tell him is a different matter altogether, but you should. Second, next part is the fees of an ophthalmologist, which is quite a subjective thing, but this should be reasonable. These you can look at the market around you, look at other ophthalmologists around you, and then you can decide what should be my fees. The last, which is the most important part, is when you are practicing, you will come across cases of other ophthalmologists who have come for a second opinion. Never do jousting. If you feel that the other ophthalmologist or other person has done something wrong, please call him and tell him this has happened. 3, if you feel that he is not listening, then you should always call up the right body to make him understand, yes, this is what is happening and this should not be. So before you joust and before you spread some negativity, take corrective action at your level. So this is what has been described in the American Academy of Ophthalmology. Now, how you can be ethically practicing and profitable, I call them the 5 C's of practice. So 5 C's are communication, then the chair time, then compassion, your competence, and charges for your service. Whenever you see a patient, you explain the problem, explain the probable solution, chart out the best possible treatment, explain to him that what to expect and when to follow up. When to follow up is very important. You can communicate with him either directly, either your support staff can tell him, either the presentational way, or you can have pamphlets lying around where he could read everything. Chair time means that not unnecessarily spending time with the patient. It's not like whoever spends more time is more successful. You have to spend quality time. Patients don't like delays. Patients don't like long talks also. You have to, in these times, you have to discuss the treatment, you have to counsel it, and you should avoid unnecessary delays. This quality chair time can be as short as 1 minute or as long as 1 hour. Whenever you are serving a patient, do not pity a patient. Pity is different from compassion. Pity is saying, yes, you have a disease. I know you have a disease, this is the disease. Compassion is, yes, I know you have a disease and I am going to work towards curing that, getting rid you of that. This is the most important, the feeling that you express while seeing a patient that yes, you want to treat him out of his misery is the most important part. So next C is the competence. So many of us are super specialty trained ophthalmologists. Our core competence would be different from that of a general ophthalmology. So always do your best for your patient within your expertise. Do not hesitate to refer to a person of a higher competence if it is in your same field, and if it is not from your same field, please refer him. You should explain everything to, even if he is under your service, always under promise and over deliver. This goes a long way. So my core competence is in doing LASIK and cataract, but retina, I know retina, but will I do surgical retina? No, I will not. I will definitely refer. The last and the most important part is the charges for your service. Charges are subjective, but this is the most important part where the patient gets dissatisfied. The charges should be reasonable. There should not be any hidden charge. You should explain what is covered and what is not covered, especially in the insurance cases. In emergency cases, please handle the patient first. Let your support staff handle the payment part or the relatives. Charges should remain for all the patients the same. You can discount later on, but the charge sheet should be the same. So what I do in my practice is I have a master sheet of charges which my receptionist and my billing people have. So they'll refer to it in front of the patient also if needed. And it undergoes an annual review also. Surgical cases have surgeon fee or procedure charges. We don't charge anything on the MRP. We charge everything on the cost price plus a 20 to 30% markup depending on whichever it is. We do discounts on consumables also. We accept all multiple payments and we document each and every penny, even if it is a 1 paisa. So this is a sample billing from my center. What I do is in a normal premium lens surgery, monofocal lens, I have a procedure charge of 15,000. The OT charge I have calculated as, according to my CA, is around 60% of the procedure charge, which comes out to be 9,000 rupees. The consumable or the implant that I am going to use here, the landing cost is around 6,000 rupees. I add a 20% markup. Remember, I am not charging the MRP of the lens, which can be very high, and that is like the basic, which I think is unethical, that you charge an MRP of the lens, especially the Indian lenses, when the landing cost is so less and you're charging the MRP. Consumables, I have a detailed billing. This is a sample detailed billing. I have an anesthetist standby and it is costed as 10% of the procedure charge. In the city where I live, I am able to put a premium monofocal IOL for 37,210 rupees. This is, and even less. This is pretty good as compared to bigger centers where this lens surgery cost, the all-inclusive cost comes out to be around 49,000-50,000 rupees. Okay. So this is my last type. So I have shown you a few ways, simple ways that you can do so that you are ethical and still profitable. Just remember to communicate, spend some time with the patient, be compassionate, show your competence, do not hesitate to refer, and your charges should be reasonable. Thank you so much.